but it is an absolute pleasure to be here to talk on a topic that I'm really passionate about, childhood anxiety, working with paediatric OCD, two of the areas I work a lot with. It's even better to be here after leaving the chaos of my home this morning. My 3-year-old twins thought it was a good day to give themselves a haircut. And an iPad has suddenly got a cracked screen, so I did the best thing I could possibly do and left. And so I'm really pleased to be here. We're going to talk a little bit about reassurance today. I can't help myself when we're talking about this kind of stuff to give a context of anxiety, and Alana gave a really wonderful introduction. I think there's going to be some nice continuity and hopefully some key messages that you'll all be able to take away from the presentation. Someone's going to have to keep me on track with time because I have a really bad habit of rambling, and I haven't even started my slides yet. They're probably already 5 minutes in, and so hopefully you'll get a feel for those key messages, and we'll just kind of work it as we go. Can I just get a sense of who have we got in the crowd? I mean, mainly parents or professionals? Hands up if you're a parent. Here is a parenting role. The majority, psychologists, counsellors. Okay, I think that's kind of most. Any other significant others? Teachers, okay. And students, yes, okay. 2 very important kind of cohorts. All right, let's get started. You don't need to know about me. Here we go. Okay, so here we have a weather forecast for most of us. It's an opportunity to decide what you're going to wear for the rest of the week, to complain about Melbourne's weather. But for one of my 7-year-old clients, it's the apocalypse. This is the worst thing he could possibly see. He sees some storms and some clouds on the horizon, and he becomes acutely overwhelmed. He's a young fellow who, if it happened to rain at school, any heavier than a light mist, he would be under his desk, he would be crying, he'd be very distressed, he would try and run out of the school. He'd be very reluctant to go to school in the morning if it was remotely overcast, and certainly if it was storming, he would be inconsolable. So a typical kind of process for the family is a conversation like this is going to be, is it going to rain? And as a parent, we kind of say, well, I don't really think so, depending on, if you just want to make it up, even if it is going to rain, you'd probably say, I don't think so. Are you sure? And there's that reassurance. I've got to start to try and decide and make sense of it. I haven't checked, but it looks cloudy outside. This boy, he's so attuned to any potential threat and danger in the weather. Of course, we'll try and, often as good parents that we are, we'll say, it's going to be fine. He'll still say, are you sure? I've got to try and find that reassurance. And of course, we wouldn't say this out loud, but we're kind of all thinking, holy, this is happening again, and it's already going to get the day off to a bad start. I won't kind of spend a heap of time talking about this, but I like to give that context. But anxiety, it is an everyday context. We all sit here, we've all had some degree of anxiety ourselves. Of course, it's all structured around that subjective feeling of distress. It's an awful feeling if you've had it, particularly at acute levels. I had a little bit of it this morning as I was preparing for this talk. There's lots of physiological responses that come with it as well, so that lots of body clues that we're going to tap into. And of course, avoidance. And as part of this avoidance, I'm going to be talking about reassurance seeking today as part of that avoidant pattern that we see. And Alana alluded to this, trying to determine what's a clinical level of anxiety versus what's just an everyday experience. Well, we just simply look at, I'm trying to keep it really simple, which is how impaired is the young person's day-to-day functioning? Is it affecting relationships? Is it affecting their education? Is it affecting school and family life? And we could see that with Liam, and what a wonderful story. And I did want to actually say as well, don't just attribute his success to therapy. One of the things that we know about working with families and young people with anxiety is that, treatment plays a part, but it's often the family, the work that happens outside of the therapy room, that's where the magic happens. And so I think as a family, what a wonderful story and challenging pathway. So good on you to Liam and the family. We alluded to it, Alana spoke about separation anxiety. It does happen in the younger kids, but here's just a list of typical fears that we would expect developmentally over the course of someone's lifetime. So in the early infancy in those preschool years, that's where the separation anxiety typically kind of is most prevalent. Fear of being alone, some of those superstitious, supernatural fears through primary school age children, and in adolescence, of course, it's all about social related themes about not wanting to stand out, don't embarrass myself in front of people, and of course navigating that really tricky element of their psychosexual development. So thinking about intimacy and sex and all those things that we all hate to talk about with our adolescents. Lots of different disorders. I'm not going to bore you with all the details, but these are probably the main ones. So the separation anxiety disorder kids we don't have to talk about. The generalised anxiety disorder kids, they're the ones who just worry about everything. There's not too many things that they don't worry about. Social anxiety occurs more in adolescent populations. It's almost like the residual effect or the residual impact of separation-related anxiety, but it's a fear of embarrassment in social places. I won't talk much about panic disorder. OCD is a very specific and unique area, and of course there can be a bunch of kids who just have specific fears about certain things. It could be dogs, it could be spiders. That'd be my one, I suspect. Don't have to worry about that. All right, so here's some of the physiological symptoms. So this is not an exhaustive list, but again, you can have one, a lot, a couple of these things as we go along. But certainly shortness of breath, the heart palpitations and heightened blood pressure. I guess from a psychological perspective, we know it's just it's a horrible feeling. And our thinking can change rapidly, and Alana touched on that as well. And from a behavioural point of view, escape and avoidance is probably the big ones. And of course, these kids can present with all that range of somatic complaints, so headaches, stomach aches and pains. And they can sometimes be that really early indicator that we might have a burgeoning anxiety problem. Here's a bit of a reflection. These are from some of my clients, how they talk about their illnesses. I'll just let you have a quick read. And of course, this is for our less articulate adolescent clients, but it's still equally compelling the way that they convey their experience of anxiety and OCD. And it just kind of reiterates the importance of being able to provide appropriate treatment. And I suspect I would have been really curious to see what Liam would have written to say what his experience might be like or might have been like, particularly when it was at its worst. So what do we know about anxiety? So I'm just talking generically about anxiety, not specifically about OCD today, but it is one of the most prevalent disorders in childhood. So roughly speaking, and this is a fairly conservative number of about 2.5 to 5% would have clinical levels of anxiety. Some studies have shown much higher rates, but if we were just going to be conservative and try to correlate as much of the research over time, that 5% mark seems to be about the number. The age of onset tends to vary depending on the type of anxiety disorder that you have, but it's not commonly or consistently been shown to be correlated with things like gender, age, socioeconomic status, whether parents have separated, the size of families. And so we're still trying to learn a lot more about it, and this is why it makes it so tricky in terms of developing appropriate treatments. So what we know is that anxiety, and again, not that I want to keep hammering on about Liam, but Liam was the classical case of it doesn't always just happen by itself. Anxiety, an anxiety disorder by itself is actually quite rare. That 40 to 60% of kids actually have more than one anxiety disorder. And what we have down in this little table here is some odds ratio. So kids with anxiety are 25 times more likely to experience depression. That's a lot. They're 2.5 times more likely to experience behavioural difficulties, including conduct disorder and oppositionality. If there is one advantage I can think of about having an anxious child, is that they're less likely to use substances. So I don't think they're risk takers. It's interesting, I'll show you what we have worked though, is that anxiety, we don't grow out of it. There used to be this kind of sense that with childhood anxiety, they're just childhood fears. If you just let it go, they'll get over it. What the research has really shown us is that it's a lifetime phenomenon. If you don't treat it, it's highly likely to persist. It's in fact 2.5 times more likely to persist into adulthood. And so treatment in childhood is really important. You're 3 times more likely to experience depression. And isn't it interesting? During adolescence, you are less likely to use substances. In adulthood, there's an increased risk. You're twice as likely to develop a substance use disorder. And we wonder about that, and I guess our thinking is around self-medication. If I'm feeling so horrible, I've got to find ways to try and make myself feel better. And unfortunately, substances can provide that. And also, I think that kind of these kids into adulthood would probably be a little bit more isolated with all that emotional discomfort. In an Australian context, we had a large-scale government study in 2015 that looked at a sample of kids between the ages of 4 and 17. And what it found was that 278,000 children in Australia between the ages of 4 and 17 were found to have symptoms that would be enough to qualify for a diagnosis of an anxiety disorder, second only to ADHD. And we know that with major depression there, which is the MDD, there's a lot of literature and education that's going on through the wonderful work of Beyond Blue and organisations like that. But I still was staggered to see that we've got this significant public mental health concern, anxiety, that I don't think that we're talking enough about. And we need to keep talking about it and bring it to our awareness. And again, this is why I like to really come to these kind of events, and I'm really pleased to be able to talk about anxiety, because it's much needed. That's just a breakdown of the particular anxiety disorders, and you can see that separation anxiety tends to occur a little bit more in the younger kids. OCD, generalised anxiety, pretty consistent across the age ranges. Again, I'm not going to spend a heap of time talking about it, but these kind of next 2 slides will hopefully really ram home the message that anxiety is complicated. And there's lots of different factors that Alana actually alluded to in her last slide, so I can skip over some of this. But in terms of genetics, yes, there's an increased biological predisposition if you've got a family history. It does run in families. There isn't an anxious gene though. We haven't found it. I don't think we will find it, but people are still looking for it. So the idea is, and the message I always give to families, is that biology is not destiny. Just because you have an anxiety disorder doesn't mean that you're going to have a child with anxiety. You're actually more likely to have a child that doesn't have anxiety. That's the stats. So biology is not destiny. Temperament, I don't have to talk much about that because I think Alana did a really good job of explaining it, but it is those behavioural inhibition, I'll spit it out, that we find, those shy and withdrawal kids that are the ones that are at greatest risk of developing anxiety later on. So parenting and parent-child interactions, many moons ago, parents copped a really rough end of the stick from psychologists and mental health. We blamed you for everything. I would never have gone to see a child psychiatrist or a child psychologist back in the day, because it was, finger of blame was firmly in the parents. It's what you're doing that's kind of stuffing the child up. But what we've actually learned is that over time, is that it's this bi-directional relationship. And again, this is probably one of those key messages I'd like to take home. Kids shape parents just as much as parents shape children. If you've got an emotionally sensitive child who is quite tearful, quite fearful, and gets distressed in certain situations, as a really well-meaning parent, you're probably going to lessen their exposure to it, right? Because that's what we do. And that might not be how you want it to parent, but that's kind of the child shaping us a little bit. So if I was going to give you a really important message, when you're thinking about anxiety, it's not just about as a parent, like, what have I done? Think about how the child and their emotional state has shaped you over time as well. Modelling and learning, absolutely. Kids can, through conditioning, can learn how to be anxious, but it's typically through their little temperament or their personality filter that is the deciding factor. And of course, negative life events. We know in the media in recent times, all the apex kind of stuff that we're talking about and home invasions, it certainly has elevated a lot of that potential threat of safety concerns with a lot of my clients. and they're quite preoccupied about it. They're having trouble settling themselves or sleeping at night, and they're a little less likely just to kind of wander down the street that they might have done in the past. So exposure to that, either direct exposure or even just hearing about it on the news and those kind of things, or talk in the playground or schoolyard, can have an impact. The cognitive factors are an important one because that's where a lot of our work happens in terms of our role as psychologists. So looking at these little biases, these are the kids who can find threat and danger in even the most innocuous, neutral situations. It's just how their little kind of brains become wired over time. And because I like models, this is the model. This is not my model, by the way. I'd love to claim it, but this is from a collaboration between Jenny Hudson and Ron Rapee. Now, Ron Rapee, I know that Alana mentioned a couple of authors. Ron Rapee is another really prominent Australian researcher in child anxiety. So he works out of Macquarie University, and there's some fantastic resources available from them as well. But that just shows how you can put all those different factors together, and that's what contributes to anxiety. I think it's a much more complicated model than that a lot of people would expect when we start trying to simplify things. In terms of the cognitive and behavioural characteristics, again, for kids, they worry a lot about the specific events involving danger and harm. It's all about that catastrophisation. It's the increased risk of danger, even though it's of low probability. And in terms of the behavioural stuff, now we're getting into the kind of nitty-gritty of escape and avoidance and the reassurance seeking, really common. What are the anxiety thinking errors? Essentially, they're all about that harm, threat and danger, and these are the kids that just don't tolerate doubt and uncertainty. Particularly the kids who are seeking the reassurance from us, they're really telling us that I am really struggling with tolerating that doubt, and the uncertainty and evokes a really horrible feeling within them. And I guess the other part to that is these kids often don't feel like they've got the resources to cope. So sometimes we might all have that little bit of doubt and uncertainty, but we might feel like internally we've got those resources to deal with it. Anxious kids don't. I won't go through these in particular for the purpose of today's talk, but I think catastrophising is probably a big one for anxious kids. They tend to kind of think very much in that doom and gloom mentality. Did I skip too far forward? Oh no. Alright, so reassurance. Alright, that's what we're here to talk about, and let's see if I can make some sense of it for us to give us an idea what we could do as parents or clinicians or budding therapists in the room in terms of dealing with this idea. Again, I don't want to demonise reassurance. I think we all seek it. We all would benefit from it from time to time, so it is a common human experience, much like our worry feelings. And it's that need to seek out safety-related information about potentially threatening situations and relationships. And again, we might just have a bit of doubt and uncertainty within us. We're a bit unsure about it, so we might seek information out to help us make that decision. So reassurance, I think it's kind of okay to a point. We're going to talk about it because I really want to distinguish between what I would just call that everyday reassurance versus something that becomes excessive. And that's when we've got a problem. But typical triggers are just indecisiveness, uncertainty about decisions in relationships. Like, what if I do something and I share this with Sally, but then Renee gets really upset with me, and they start to worry about that. And if I haven't had that kind of life experience, I might not know what to do. And just those perceived general threats that we've already kind of spoken about. So again, that message is just some reassurance I think is okay. Let's face it, kids, they don't have a great deal of life experience, particularly younger ones. So they look for other people, particularly parents, caregivers, teachers, to get information about the world. Adolescents, they look more to their peers because us grown-ups, we are stupid. We don't know anything. They know everything. They've got it all worked out. You've never lived it. You've never done it, mum and dad. So adolescents tend to look for their peer group a little bit more. So essentially it's like a little risk assessment. When we're seeking reassurance, we're just trying to work out, is there some kind of safety concern or danger that I need to be aware of to help me with my problem analysis? It can reduce worry sometimes for some kids. It gives a little pseudo sense of control, but certainly provides a little greater certainty. Never really provides absolute certainty, but it can kind of help you make some decisions. All right, let's talk about excessive reassurance seeking though, because this is where the problem lies, particularly because it's very common in kids with anxiety and particularly with OCD. Indeed, it's almost like a symptom of OCD that's really common. And so it's basically the same definition, but we'll just add the word repeatedly in there. And it's over and over and over again. I don't think as a parent myself, or even in my clinical work, it's pretty easy to recognise when that it shifts from, say, everyday reassurance to something of a clinical concern. It stands out quite a lot. And I think if I took you back to that model that I put up about all the factors that contribute to anxiety, why do they seek reassurance? Probably for a whole host of all those different reasons. Here we go. So what does it look like? It can come in lots of different forms. I mean, we've spoken a lot really about everything. And at first, it was my first meeting with the family. At first I thought, oh, what a delightful little fella. You know, he thought he'd made a mistake, but then it kept going. And I couldn't work out what he was apologising for because he'd hardly done anything. And then I thought, am I doing something that's kind of making him feel like he wants to apologise? But as it turned out, that was the reason why they were in my office, because he was doing that everywhere. So it wasn't just about me, which is very reassurance, providing some reassurance for me. So that can happen. Searching exclusively on the internet or in books for information. The internet, Dr. Google, isn't that a fantastic invention? Right? We call it, like, I've heard it referred to as cyberchondria. That's kind of like an interesting one. And you know what? I've actually done it. I can't say I haven't. Last year I had a really bad virus or cold that I couldn't get rid of. And I did exactly what I tell all my clients not to do, which is I punched in my symptoms into Google. And much to my relief, luckily, I only had polycystic ovarian syndrome. And so at that point I realised, oh, what am I doing? I know I'm feeling poor, but that is just a really stupid thing to have done. So, but we go searching. The internet unfortunately provides us, but it can also provide a lot of misinformation. As parents, you can kind of punch in excessive reassurance seeking and you're going to get like 1.5 billion different sites you could look at. And a lot of it can be a lot of misinformation. Parent bloggers. No, I'm not going to go there, right? Oh, no, I'm not. But make sure you're getting your information from the right areas if you're doing it. Right? Not some random mummy blogger or daddy blogger that thinks they know everything. I'm not pretending that I know everything, but sometimes that information is just ridiculous. They can check things over and over. I did a little bit of that, apart from checking that I brought my notes with me today. But I did make sure I had my USB stick about 30 times. So I've kind of done a little bit of that, and obviously a lot of overthinking about things. So this is kind of like another client of mine who had a lot of worries about eating. And so with food-related contamination through germs, this is kind of like, what the parents had to put up with every single night. Like, was the food in date? Is it safe? Did you use a clean knife? Did you wash your hands? So everybody's kind of just checking in. Are you sure? That one always kind of pops up. Did it look all right? Is it cooked? Mum, it's chicken, that's potentially lethal. There's salmonella written all over it. And then that kind of the lovely, are you really sure? Like, I've just told you 14 times in the last 5 minutes that it's actually safe, but they really struggle with it. And so our reassurance, our words just clearly aren't hitting the mark if they're still asking those questions. So what are the impacts of excessive reassurance? Well, it's particularly annoying and frustrating. I don't know a family that really enjoys that kind of process. I actually don't know a young person either who really enjoys it when I think about it. So it's very much a shared experience. It certainly impacts on relationships, the amount of tensions and frustrations that we see in a clinical context when families and young people arrive and they can sometimes, it's like a little ticking time bomb. In terms of how we can hold these families in that moment. It's particularly time consuming. And Alana mentioned this at times in her presentation, but it's a temporary relief. We've got to really focus in on this idea. It's only temporary. It's like short term. If they're continuing to ask information, safety related information, then clearly it's not doing its job. Because if you had said it once, then that should have been enough. So when it becomes excessive and they're asking it over and over, that's when it becomes addictive. Because if we think about that idea of relief, how does the brain interpret relief? Relief is a positive experience. So if you get it, the brain wants more of it. So if I've given that temporary relief, I've provided you with that answer, that kind of information, and you get a little bit of relief from it, then the brain goes, hey, good idea, that worked. I feel much better now. So next time this happens, why don't we do the same thing again? And so that's where, and Alana actually alluded to it, it's addictive. It kind of, because it works. It's kind of like an unfortunate kind of impact of the reassurance seeking is that they get a little sense of relief, which becomes reinforced. But what it does is it just keeps the anxiety alive. And the worry, it kind of sends a message that the worry must have been important. So in terms of the cycle, basically you've got a young person who struggles with doubt and uncertainty. They seek the reassurance, they get the temporary relief. That avoidance is reinforced because they haven't had to deal with the problem. They've only dealt with it because you've told them how to deal with it. And then it establishes all these beliefs about themselves, about the world, about coping. So all those beliefs become reinforced, and then the process starts again. And that can happen within a minute. So it doesn't take long for it to be reinforced. So it is an avoidant technique that is very common, and you've got to look for it. Sometimes it's really obvious, but sometimes you need to look for it. But essentially I'd ask us all ourselves is what are the messages that we're really sending about the child and their capacity to cope? And this is what we have to think about as parents and clinicians and how we respond to it. We're basically saying if we give all the reassurance and all the information to them, that we actually don't think that you've got the resources to cope. And I wonder what that would be like for your sense of confidence and autonomy and independence. What messages are we also sending about how harmful the problem or dangerous the problem is? So essentially we don't want to impede the development of the child's independence and autonomy. And of course the classic one is if you give reassurance and you get it wrong, guess who gets the blame for it? So always be careful. It's like when someone says in my room, it might be a nighttime worry about, I'm really worried there's going to be a home invasion, that we're going to be robbed. I will never, ever in the history of my career say, it won't happen. Because I am fearful of the consequences of how they're going to respond to me if they happen to go home and it does happen. So it's not about so much, can I give them the reassurance and give them that sense of certainty, but what I'll be telling them is I'm going to help you manage the doubt that it could. I'm going to help you kind of explore all the evidence and help you with your thinking to help you decide and deal with that doubt that you're feeling about it. Not tell you that it's not going to happen. I don't want to spend a heap of time on treatment, but we don't just treat reassurance seeking, we treat anxiety. We know that reassurance seeking is a very common part of that, but we really aren't just going to be focusing on treating reassurance. It can form a part of it in certain, it can be a specific component where we might have to say to parents, all right, it's time to turn this off now. There's no more excessive reassurance seeking. I'll talk about how we might navigate that process a bit later. But essentially, we're trying to develop skills for the young person. The aim of treating anxiety is about developing that skill set. What are the things that this young person is perhaps struggling with that we can then arm them with to deal with their emotional discomfort? And as Alana also alluded to in her presentation, it should include parents at some point. Adolescents can be a bit fiercely protective of their space, but with most younger kids, you can get the parents involved pretty readily. When we talk about cognitive behavioural therapy, because we love fancy words in psychology, it makes us feel very special, but we're really just talking about the interactions between how we think, how we feel, and then what we do. So basically, kind of really simplistically, is what we think about a situation, ourselves, or something else, will affect how we feel about it, and how we think and feel about it will determine what we do. So that's a kind of simple CBT model for all of us to take away. What does a treatment plan look like? I won't go through this in great detail, but we do a lot of education with parents and young people, so we try and debunk any myths that they might have about anxiety and about their ways that they might be dealing with it. And that might include excessive reassurance seeking, talking specifically about it, letting them know that it's a temporary relief and showing them and drawing it and giving them as much information to help them decide and to recognise why we're actually going to help them face their fears over time. So we help them look and identify their body clues. We do some relaxation, arousal regulation. people who probably work with me recognise I don't do a heap of that. I find relaxation boring. And I feel like most people can probably do enough relaxation stuff outside of the therapy room. They don't need to pay me to teach their child to breathe. So I do encourage it. I'm not against it. I just don't do a heap of it in my work. I tend to focus in on the thinking errors as much as I can, because it's kind of like, for me, I always think if you're already anxious, like that's like the gun has already been shot. The bullet's out. And if you're then doing your relaxation, that's okay, it might help you get through it. But I'm more curious about what got you anxious in the first place, and I'm hedging my bets that it was the thinking error that got you there. So if I can work on that thinking error first, I might reduce the likelihood of the frequency of you being anxious. So that's just the kind of philosophy that I work with. Everyone's slightly different, doesn't really kind of, in the research, using or not using relaxation hasn't been shown to be remarkable. The exposure training, that's kind of the really fun stuff. Well, it's fun stuff for the therapists and families. It's not so fun for the young people who have to face their fears, but we do it gradually. We use lots of reinforcement, so lots of rewards and recognition, and we hope to get to that point where it's just fun and good time. I won't go into this in a heap, but again, it's realistic thinking. That should be our aim. I don't do positive thinking. Right? Again, it just sounds a bit cheesy. It's like being on an American sitcom. Right? It's just a bit kind of, it's a bit, it doesn't feel right when you do it anyway. And I can think of plenty of situations where it's really hard to think positively. So it's not so much positive, but can I get you to think realistically? And here's some of the questions that you might ask about it. We help the young people try and think of realistic consequences and have a look at their kind of realistic, develop a realistic thought to replace the unhelpful one. So we try to help them identify what is that unhelpful thought. If you can identify it, can you replace it with something that might be a little bit more helpful? As part of that process, you also might be looking at what other resources do they need. And if they haven't got the experience, the life experience to say, well, this has happened in the past, get creative. Either get them thinking about their peers or what they've noticed in the environment, or you can obviously lend a little bit of your own. Or you can set up a scenario where you experiment. It can be just as good. So here's a classical situation of a parent coming home late. For an anxious child, a typical thought is that something disastrous has happened, that mum's been in an accident, she could be dead, she could be abducted by aliens, it doesn't really matter, it's just unpleasant. And so we get them to rate their responses, so it's an 8 out of 10 worry for that young person. And here's the reassurance, look out, mum's going to have 55 missed calls on her phone if she's more than about 5 minutes late. And their son or daughter could be just standing at the front window waiting in tears, waiting for that kind of, for the mum to return to alleviate that little stress. And so we get that evidence testing happening. This is how we would work with it in a session. And you can do this at home with your kids as well. Just thinking about all the evidence. And so, more often than not, this doesn't happen for everyone, but, mum has been late before and she's been okay. She could be stuck in traffic, mum is a good driver. Sometimes that could be variable, but more often than not, mums are good drivers. I'm not going to have to hide behind here in a minute if I keep saying that. And dad's with me. Dad's here with me and he doesn't seem too stressed. So what does that say about how stressed I should be feeling about that situation? And if they can then come up with that realistic thought, there could be lots of different ones. That's not just the perfect one that we go for. But the probability is that mum will probably be home soon. How worried do I feel? Well, mum's not home yet, so I expect that they're still going to feel a little bit worried, and that's okay. They don't have to feel happy. That's not the end result that we're looking for. And that the young person has either finished their homework, if they're a delightful little soul, or they just kept playing with their toys or electronics as it happens to be. The exposure work is all about the small steps that we take to help a young person face their fear. And we break each problem down into lots of small steps. We reward and reinforce each of those steps. It's the active ingredient in therapy. You cannot treat anxiety or OCD if you're not doing exposure work. So you have to be able to help them face their fear. And that's not always easy. The construction of these exposure exercises and the step planning, it's difficult. You've got to do it well because you want to avoid a too big a step. Most anxious kids, if you kind of said to them, if they came in and they were asking their parents 25 questions a night about a rash that they have, which is just either a little bit of eczema that they've had since they were 3, but they're thinking it's a new version of Ebola. You might say, well, for mum and dad not to provide any reassurance at the first step might be really hard. So you might start to reduce it in terms of frequency, and then you help support the parents and the young person. So it's all about that planning. And if just to give you a working example of what it can look like, so this is an example of a 6-year-old girl who came to see me with a very significant dog phobia. So it got quite dangerous where if she saw a dog, she would run across the road. And here's the steps that we took. So the idea of being in contact and in a room with a dog was too much. This is all our pre-planning. So we really just kind of looked at it and went, right, okay, what do you think you could do? And again, she's 6, so she was pretty and she was quite strong-willed, but she said, well, and I just raised the idea, well, why don't we get us like a lot of little toy dogs and just play with them? So we started with that, and we looked at some YouTube videos, and as you can see, we just incrementally, then we introduced a real-life dog, a delightful little King Charles Cavalier, Elmo, and we gradually reinforced, because her fear was about being bitten. It was the unpredictability of dogs that she just couldn't tolerate. And so she worried about them jumping and what that was going to do. And eventually we got her to be in the room with this dog that wasn't tethered. And then we kept going afterwards to help her kind of visit local dog parks and those kind of things. I have seen her sister recently for a different anxiety condition, but I did hear that she's still doing really well, and the family had purchased a dog, which was really lovely, and they're really enjoying that. Okay, so how do we respond to it? I guess this is what we're kind of here for, and let's see, how have I got for time?
Got half an hour.
I've got half an hour. I am smashing this. We're going to have an early lunch at this rate. All right, I'll slow down. Right, so responding to excessive reassurance seeking. The ultimate goal is to help the child's capacity to tolerate doubt and uncertainty. Therefore, we need to reduce or eliminate it. Now this is, remember, I'm trying to keep that distinction between excessive reassurance seeking and just everyday reassurance. If it's a clinical problem, we have to work towards the idea of not giving the reassurance. So in terms of the strategies, all right, communication is always a key, and Alana alluded to some of this in her presentation. The idea of listening is so underrated. We don't think about this enough, but we really should. So, and think about this term, we kind of, in therapeutic terms, we talk about it as reflective listening. So we're reflecting back what we've heard. As parents, as teachers, as caregivers, and even as therapists, we at times flap our own lips too much. We interrupt. They've just started telling us something, and then we ask some stupid question, or we provide a comment, or we tell them the answer. And of course, we're not doing it because we want to be causing harm or continuing the cycle of anxiety. We're doing it because we kind of know the answer. There's a pretty obvious one, some of the ones like, should we worry about this? No, you probably shouldn't be. We've got nothing to worry about. Don't worry about that, it'll be kind of fine. And so I think what we do is if we kind of interject in that way, we're either devaluing the fact that they're feeling uncomfortable, that we're kind of making them feel like, oh, well, it's not worth communicating about, so that maybe the problem's not so important anyway. And for adolescents, if you kind of provide the solution really quickly, their eyes just roll over. You lose them really quickly as soon as you kind of apply that solution. Oh, have you thought about this? Now, again, the idea, the solution itself might be really appropriate, but it's just the process that underpins it. The one thing we want to do is get kids talking. So questions like, tell me more about that. So when they're first, if I ask a question in therapy, I'll say, tell me about that feeling that you've been getting. I just let them talk. And I'll just sit there and listen. I'm listening for those emotional themes. But I want them to talk. And as soon as they've got to the end point, and sometimes it's really quick, because some kids have really brief responses, but others are quite articulate. So after they've done that, then it's the questions like, tell me more about this part. I'm not guessing. I want them to tell me as much as they can about the scenario. And that can be 50 minutes worth of just, okay, tell me more about this. Tell me more about this scenario. You said a little bit about what happened there. and then you told me about this part, but I'm wondering what happened in the middle. Can you tell me more about that? So these neutral lines of questioning, and neutrality and curiosity are our weapons. These are the things that will work really well for us. So, and it's hard because particularly if you work with adolescents, they just have some really stupid ideas. They do. They should just have a big neon sign above their head that says under construction. Because they just are they're biologically programmed. I don't know how we all survived it. Because we just make stupid decisions. But they think they're good ones. I know, they haven't thought about the consequence. Right, and so our job is to kind of sit there and go, oh man, you are not thinking about this in a clever way. I can see where this is coming and where this is ending, but they can't. But instead of telling them that, you kind of guide them through that process. See if they can start to think about the scenario and their emotional state. So this idea of reflective listening, I probably couldn't stress it enough. It's really critical for us. And if we get it right, it takes out half the battle. Because some kids escalate their emotionality when they don't feel like they've been heard. I'm trying to tell you something. You keep talking. You keep telling me how to solve it or that not to worry about it. But and some kids, and let's face it, adolescents are prone to this. I don't want to be told the answer. I actually just want to talk to you and share it with you. And that's okay. And that happens with therapy as well. So we don't have to feel like we need to solve all the problems that come our way. But sometimes just the process of talking about it is the powerful agent of change. Validating and acknowledging. Again, this is actually pretty easy to do, right? But again, we probably miss opportunities to do this in our day-to-day busy lives, and even in therapy. But it's really important, and this is where I said earlier, when you're doing your reflective listening, you want to try and pick out emotional themes. What is there a feeling state that they might be going on, or did they describe an emotional state? And if they are, I really want to acknowledge and validate how they are feeling. Not how I'm feeling. Like, I'm really annoyed that we're talking about this same thing again, 4 nights in a row. It's about how they're feeling. And Alana used some of those words like, you seem really worried about that. And yeah, it seems a bit flowery on the surface and kind of like, oh, this bit of psychology mumbo jumbo. But it is really effective if you can get it part of your language. Kids aren't taught about feelings. It's not in school curriculums. But we're getting a little bit better at it, I must say. Some schools in particular are starting to think about this social emotional guidance rather than just academic curriculum. But otherwise, kids are left to mostly work this out for themselves. We were left to work it out for ourselves. And you do get there over time. The majority of us do, but there's certain kind of cohorts of kids that are at greater risk of this. So talking about feelings and validating how they're feeling is really important. And again, think about that kind of young person who really feels the need to escalate. If they don't feel like you've heard or understood what they're trying to tell you, again, it just gets in the way of communication around the problem. Undoubtedly, anxious kids evoke a strong need for us to be patient. Cannot stress this enough. And you know what? And that must be really difficult for parents to hear when they come and see a professional. We've really got to be patient about this because often they've been dealing with this for an extended period of time. It's like, don't ask me to be patient, like I can't do this anymore. But we have to be really patient because I guess the road to recovery isn't a linear one. It doesn't just keep getting better and we all have to kind of surf those ups and downs. We have to ride that roller coaster together. And there can be things, you can be doing really well and you have a setback. And everyone kind of feels a bit deflated at that time, but it's important that we just hold in the back of our mind, I've got to be really incredibly patient. And when you've got a young person who's anxious, who's distressed, who's tearful, who's on the floor rocking because they're overwhelmed, it's incredibly hard to be patient. Or if you've got 3 other kids at home and one is doing his best impersonation of a puddle on the floor, and you've got school drop-off at 2 different schools and you've got to somehow transport yourself to work in the city, it's very hard to be patient. It's stressful. I was stressful thinking about that scenario, and sometimes I get really stressed thinking about what some families do have to go through in the morning. But patience is the key, because if we start to overload our own emotional state into this already quite volatile emotional landscape, then we are at risk at further explosion. And so that respect and acceptance, yes, we can use that for younger kids as well, but I'll probably pop that in more for the adolescent groups, because this is where, again, that idea of agreeing to disagree sometimes, that think about adolescent development, that they're identifying a little bit more about who they are, their identity, their values, what they stand for, what kind of bloke or what kind of girl they want to be. So they're starting to try and work that out, and that might be in disagreements or in conflict with what your own values or beliefs might be about things. So we're going to try our best to try and get on board with them, so we're not just at war about silly minutiae, but we're actually focusing in on concern that they're bringing to our attention. When it comes to excessive reassurance seeking, we want to reduce or eliminate it, absolutely. And the planning, just like I showed with the planning for the girl with the dog phobia, and taking all those small steps. And there were a few setbacks in amongst that. I didn't kind of put it in because I wanted to make myself seem really good. But we had some setbacks in it. But the planning is absolutely critical. I'd never ask a parent just to stop giving their child reassurance without having given the child some forewarning about it. That would just be kind of cruel. You're just kind of letting them just hang there. As they're asking that question, do you think that this kind of little rash on my arm, do you think that's spreading? And the parents are just kind of scrubbing the dishes, kind of, watching TV, and and then the young person's still standing there, kind of like, Mum, Dad, this, it's important. And then they're waving in front of your face, and you're just sitting there, kind of. I don't think it's going to work really well, because my suspicion is that their emotional discomfort is about to explode. And you're going to go from an anxious child to a pissed off one really fast. So we don't want to just say, right, don't do it and just see what happens, right? That'd be really cruel. But we plan for it. This is where all that education component at the start of treatment, or even, I'm talking about it from a treatment perspective, but even as a family discussion, you can say, right, I know that if I keep telling you the answer to this, or I keep giving you this, it's not working for us. And I notice that each other night or soon after, you have the same kind of worry about whether there's some germs or whether you're sick or unwell. And so, I wonder whether or not we have to do something different. It's almost like I'm going to condemn you to a life of thinking about fear and danger if I give you the reassurance. So I want to start doing something different, and I make it collaborative. Right, we've got to do something different. Well, I wonder what we can do together. And I'm thinking maybe I should not tell you the answer as much. And if I did that, what would you like me to say? And it's starting to get their points of view. And sometimes I'll ask you to give the reassurance. You'd be like, no, that's not what we're talking about. But you want to engage them in it. And even young kids, you can engage in this kind of process. They're okay. And particularly if you're talking about it at a time where they're not emotionally aroused, you're much better positioned to get that answer. Because again, you don't start springing excessive reassurance and you've just reduced it because you're annoyed with them. So timing, planning is absolutely critical if you want to start that process of reducing. And identifying, and you might even write it down so it's like a contract, this is what I'm going to do when you ask me these questions. And remember, this is why we're going to do it, because I'm going to help you to learn how to surf those feelings that you don't like, that are horrible, that you've really struggled to deal with. I'm going to help you surf those feelings down. And we'll sit through it together, but it just means that I won't be saying much. And this is what we could do. So it's not about you have to stand there in this position, right? I've asked reassurance, I've not given it to you, stand there. Wait for that feeling to go. That's not a good idea, right? So you're going to give them something to do, right? A little distraction technique, doesn't really matter what it is, doesn't have to be rocket science. Go and play a bit of your iPad, or sit with me and watch the TV, do something collaborative. But wait and help them recognise that feeling, that uncertainty, that doubt, it does come down over time. The first time it might take a while, and you've almost got to just keep sitting through it. Because that first time, you kind of begin that production, that process of reducing reassurance seeking. It can be a difficult one. You might get a slight escalation in your emotionality. as they try and get it back to the way that they prefer, the one that they know at least works, and temporary is better than nothing, because they have yet to trust in the idea that those feelings will go down. And so we've just got to keep rounding home that kind of point to them. That feeling will go down. We've got to trust in that fact rather than trust in the words that I'm telling you. So again, the message is really, let's not provide excessive reassurance. This is again distinguished from actual reassurance, because planned ignoring can still be compassionate, and that's the message that we would give in that planning stage. But I'm actually being a good parent by withholding the information that you're so desperately seeking. And as a parent, it's really important that you trust in the fact that you're being a good parent under those circumstances, because you're evoking distress in your child, but in a really healthy and adaptive way. Not in a cruel way, but you've got to help them learn that process. And we've got a really important part in that. And again, this is where we start to pair some of those cognitive behavioural therapy strategies. And again, this might be at a time when they're not as distressed, but again, the process of realistic thinking is so critical. Identifying that source of distress, what do they fear or predict? I agree with Alana, the why question's a stupid one, we should all stop asking it. I don't ask it in therapy because I never get an answer that kind of makes sense to me. If you ask someone with OCD why they do it, good luck getting an answer for that. Because the answer will inevitably be illogical. That's the nature of the illness. Anxiety is an excessive fear. So I know that the answer doesn't really make sense. So I don't ask the why questions, but asking lots of what questions. What are you thinking about? What are you saying to yourself at that time? That's kind of, I think, a more useful line of questioning rather than the why, because they'll either not be able to tell you why, or they'll just make up something that they think you want to hear. So let's not put them in that situation, but just keep asking what questions. I like the idea of this sense of, what are you predicting is going to happen? What do you think is going to happen? And trying to get that process of separating anxiety from their own thoughts. And more often than not, particularly for those kids who have chronic anxiety, that's a really hard process to engage them in, to recognise an anxious thought versus one of their own. And so trying to separate those two styles of thinking is pretty critical in the work that we do. But yeah, that prediction is really important, and you get as specific as you can. For someone who might be anxious about doing a presentation in front of the class, or what is it about the presentation? What do you think is going to happen? Right, I think everyone's going to laugh at me. I'm going to make lots of mistakes. Okay, all right. So when you make a mistake, what do you think is going to happen? Well, everyone in the class is going to laugh. All right, you told me everyone in the class is going to laugh. Is that what you actually mean? Like every single person? Yes, every single person. All right. What about you? Like, what do you think you're going to be feeling? I'm going to be really embarrassed. I'm going to be like a red tomato up on stage, and I'm going to be nervous and be shaking. And so we're just trying to get them to think about what their prediction is. And like, you know what, if you make mistakes and you do kind of up there and you are really nervous and you look like a tomato and, you know, people do laugh, what do you think is going to happen then? And then it's then you start to get down a little bit further into what it is that they're specifically fearing. And sometimes it can be like, oh, well, everyone's going to start talking about this and tease me about it out in the playground, and that will be horrible. You know, and so all of a sudden that kind of changes the landscape a little bit when you're working with these kids in terms of where you might target your thinking-based strategies. So if it is about that kind of idea of, often with the kids I'll just talk about what's front page on the news, and one day is very different to the next. But often you can get them into that kind of process of realistic thinking and their evidence testing. Have you seen someone else do a presentation before, and have you noticed someone being embarrassed? And how did everyone else react? How did you react when the person was there? And so you start to get them like thinking about their experience in a way that they might not have been doing for a while. And of course, an important question is there any other resources or support that you do need to help you make your decision about how you're going to deal with this discomfort rather than me giving you the answer? And so therein lies a really important concept of that collaborative problem solving. So if I'm going to help a young person think through their experience, I'm not giving them the answer because that's providing that reassurance. I become their external conscience. They only do things because I say it's safe, or mums and dads say it's safe, not because they believe it. So they don't trust in their own judgment. And that is the absolute risk of excessive reassurance seeking, is that we erode the capacity for the young person to trust in their own judgment from a very early age. And so if we can kind of catch ourselves in that moment, we really want to promote it. And the idea of collaborative problem solving helps us with that. All right, so we've got this kind of dilemma, this problem. All right, hey, what are our options? What do you think, what else could happen? It's those kind of questions. Again, they're what questions. They're not why, they're what questions. And those questions can help. And if they get stuck and they don't really know the options, then you might say, well, I thought about this. What do you reckon about that? What's the advantages, or what's the good things? What's the not so good things about that? So I might throw one out, but it's just a suggestion. I still want to see if I can prime them to come up with some other solutions. We use the step planning philosophy, the graded exposure. It's the way to go. If we're doing anything else in treating anxiety, we're probably not doing the right thing. And predictability and consistency is fundamental when we're working with these kids. We really want to be predictable and consistent, and particularly if we're using planned ignoring, because it's no good if dad's an expert world champion at ignoring and mum is kind of overcompensating, or vice versa. Or, like in a case that I saw actually yesterday, which is a particularly anxious young fellow, it's probably separation anxiety would be his difficulties, but he's never slept independently since about the age of 2. He's now 11. And so he came in with his mum, and they tried a lot of things over the journey, and he just can't tolerate, he can't fall asleep, can't settle himself off to sleep. We weren't sure, he didn't have a specific fear of the dark or anything like that. I just think kind of the chronicity of his difficulties, he had no confidence in being able to do this. And so we worked hard a couple of weeks ago, I saw them yesterday, and we worked hard a couple of weeks ago to do all the education and planning. And I just said, do you want to give it a go? Like, what do you think your first step could be? And so he started to think a little bit about it, and he'd been relying heavily on his brother. So when his parents kind of got sick of the idea of, I have to lay beside you, he had a brother 1 year younger, and so he used to either jump, he used to kind of coerce him, bribe him, you can use my PlayStation time if you just come and lay beside me, because that comfort is really settling. And so they had been kind of co-sleeping for about 18 months. And it was fascinating because we got to the session yesterday. I said, how do we go? Like, have we got a first step happening? And yes, we have. But it was his brother that really struggled with the separation. So he got to the point, we'd done all that work in our session about educating and trying to help it out. And he was like, all right, Joe, get out of my room. I'm going to try this tonight. I'm going to do this. And Joe lasted about 10 minutes before apparently he was running into mum and dad's room going, I can't do this is too much. So now we're doing family work. So predictability is really important. We've got to be consistent, predictable in what we're doing. If we kind of turn out an about face, even that kind of one moment of weakness, we're sending the wrong message. It can really complicate things, and it confuses things for the kids. And so that's mainly how we deal with the reassurance. Here's my kind of general summary of how I would parent anxious kids. Promoting brave decisions, absolutely. Right? Lots of praise and encouragement and rewards. Consequences and limits, they're boring, they don't get us very far, and the gains aren't that well sustained. If you want to become a really unliked parent, use the consequences a lot, but if you want a really strong, healthy relationship with your kids, tune into the stuff that they're doing well. Every one of us thrives on positive attention. We love it in our workplace, we need good grades at school. Anything that's positive, we just love, we want more of it. So give it to your kids. Promote independence, help the kids fight their own battles, don't fight them for them. It was interesting, I had a mum whose daughter had a lot of quite significant OCD and lots of generalised anxiety on top of that, which she had a recent school camp. And I loved it because I knew we'd hit the mark in our therapy when she came in and said, right, she's got a school camp coming up, and mum was petrified about this. about whether this is going to work or not. I actually had a discussion with her daughter beforehand. I felt quite confident about it. But the mum said, like, I had spoken to the school about whether or not I should go on the camp with her. And then she said, but then I worked out what you would tell me about that. Which was, no, you're all going to be having a week to yourself, enjoying a latte with your friends. You're not going to be on some orienteering bush climbing. And so, it's those kind of messages, you're starting to get somewhere when families can reflect on that idea about their instinct was to kind of protect and keep her safe. It was adaptive, but really unhelpful in helping her daughter fight that battle. And she did the camp really well. Again, I mentioned that earlier, the idea of, with the no excessive reassurance seeking, you need to be pretty clear on that. We don't want that scenario where they just face their fears because other people, or mummy bloggers, or daddy bloggers, or parent bloggers have told them that's okay. Skill set. We've got to manage emotions, we've got to help the kids manage their own, and we've got to manage ours. Right? It's a dual process, really important. Consistency, I've already spoken about. Oh man, I hate that picture. I always put it in just to kind of, just annoy myself really. There's no way I would do that. Not a chance.
Baby steps.
Baby steps. I can do the little black house spiders now.
Yeah.
Right, but huntsmen's are still my wife's domain.
Well, what's in between then? Mustard maybe?
Yeah, toy spider.
I'll come and seek your advice. You've clearly thought about this. So.
Spider on a leash.
I've got a friend who works at the zoo. He's like so keen for me to go there and do something like that. I'm like, not a chance. Not yet anyway. I'm too busy helping everyone else with their life. Encourage the realistic thinking and the step planning. I've kind of probably said that enough. Reinforcement. In terms of reinforcement, don't use money. That would probably be my one advice. Don't remortgage the house. The best reinforcers are the ones that strengthen your relationship with your child. Things that you do together, little family outings, a little dinner, those kind of things. So think about rewards in that way. And this is just a client that I work with. I always like to conclude it because it tells a story. And this was a young girl, an adolescent girl I recently finished working with who had really severe OCD. And it always kind of makes me value the work that we do, and it always kind of makes me think about how hard parents are working behind the scenes as well. And that's all from me.